Director of Nursing here. Been a nurse for, I always have to do the math, I think I'm 17 years now. It's kind of like your age, you forget after about year 5. Been in nursing education for 11 years now. So the majority of my educator. Our programs with an S, we have an undergraduate program, which is a traditional BSN program, which you have 2 years of prerequisites. Then you have 2 years in the nursing program. So that you apply for the second 2 years to take our courses with our amazing faculty. Graduate program wise, we've always had a nurse admin track, probably pretty hidden for most people. But this fall, we're launching a psychiatric mental health nurse practitioner program. So our first cohort will hit in fall 2021. Super excited about that. Mental health is a huge issue here in our community, and just ready for that program to launch. Pass rates, we've got 100% pass rate for our 2 graduating classes with our undergraduate program. So that is, again, contributed to our rockstar faculty. They're teaching them what they need to know and getting them very well prepared. 100% employment rate before spring break for both of our graduating cohorts. Again, compliments to our faculty. They're teaching them how to work through behavior interviews, because if none of you have ever worked through a behavioral interview, it is the most horrible interview you ever do. Because they give you a scenario and they say, well, how would you deal with this? Or what is your experience with that? Well, as a new grad, you're like, I have no experience. So our faculty are teaching them how to answer those questions appropriately and very well. So they're getting jobs. They're getting jobs left and right. Even during the pandemic, we had 100% employed before they ever walked out of these doors. Today, those students may tell you they're tired, and they are, because most of them walked into COVID unit nursing. So they left us and went straight to an unknown world, but they have done amazing. Talked with a few of them, and I couldn't ask for better representatives out and about. So what else you want to know about the program?
One of the questions I think I would have is, do students typically stay in the Texarkana area, or do they have a tendency to travel through Texas? I know certifications, say for teaching or those kind of things, are often state specific. Is that also true of nursing programs, or is that more universal?
So they actually can go pretty much anywhere that participates in the Nurse Compact Licensure Act, which for those of us that are in Texas, we're pretty much circled with compact states. I'm licensed and have always been licensed in the state of Arkansas. I've worked in Arkansas for 18 months. Always worked in Texas. Our students typically are staying pretty close to home, at least for the first year or two. Our first graduating class has a couple that are looking into venturing out into travel nursing and to the Dallas-Fort Worth area. Our current seniors are looking at Houston and Odessa and Midland. So this most current group is a little more diverse into where they want to go in the future. The best thing for us is once you graduate, you take your licensure exam. Again, I believe it's 42 or 45 now of the states will acknowledge your license no matter where you get it. So you're pretty much good to go anywhere except for California. They're not on board yet. Hawaii's not either, which is such a bummer. That's my retirement gig. I'm going to go travel nurse at Hawaii someday and get paid.
Somebody asked the question, how many folks in the chat are currently student-wise or nursing or pre-nursing that have come to Faculty Friday?
Oh, there's 1, 2.
I'll say I have not seen Cecilia in a while. So but I couldn't remember. Okay. Do you guys have any questions about the program? That's one of the things that we're able to do is get the assembled crew in here.
Yeah, I got a question. For the application process, I know we got to take the T's, which I did. What do you guys look into the T's? Like, what are the score requirements?
That's actually a very common question. We don't have cutoff scores per se. It's based on how your cohort looks that's applying. So you're ranked based on those scores. So if you look at them and think, doesn't look that great, take it again, because again, we'll take your two scores, because you're just going to be ranked with whomever is applying with you. Last year, the science one seems to be the challenging piece of the T's. We didn't take anybody with lower than, I believe, 860 on their science piece of their T's last year. The higher, the better for you, to be perfectly honest. And we'll super score as well. So if you've taken it twice, we'll take your highest scores from each section off of the scores that you've given us.
When do they take the T's?
Just prior to the application period. So most of them started taking it in November. I will say, if you're interested in the spring 2022 cohort, we'll be using the HESI A2 at that point. We'll be moving to a different entrance exam. That changes because we get the HESI exam, so we'll be able to compare apples to apples with our data, number one. But in all honesty, it's significantly cheaper than the T's. So that's less money out of pocket for our, which is huge. And it gives us better data. So we're making that shift for spring 2022. Does that help you? Is it Alvaro?
Yes.
Any other questions for Heather? All right, I'll ask this. How did you end up in, and this is also true, Jenny can answer it. And, Sheila, if she's still here, I can't, trying to keep track of stuff, it gets hard. The nursing folk in the room, how is it that you ended up doing nursing, and why is it your jam?
I ended up nursing in short because of Sheila. The long story of that is my first degree is in psychology. I have a bachelor's degree in psychology, minored in social work, obviously helping profession generalist here. Got married, had a baby, couldn't believe the care and the wonderful people. When I had my baby, it was not an easy delivery. So met Sheila before I had the baby, before I got married. And I just got to watch her truly interact with patients after hours, because she was a cardiologist nurse at that time, an office nurse. So she answered his calls, his pages. And she's probably really red right now with me saying these things. Just her interaction, she really taught me the caring aspect of nursing. So I said, hey, Sheila, I think I'm going to go to nursing school. She said, hey, don't. And I don't listen. And here I am. So that was the first, but truly it goes back to, if you're going to enneagram me, I'm a 2, I'm the helper. I want to help people. I want to show people compassion and caring. And it's been the best thing ever for me. I believe Jenny has a pretty interesting story, if she can talk. She's actually at clinical right now. So
I can talk. Hello. You might not be able to hear me because my mask. Can everybody hear me?
You're just fine.
Okay, so my great grandmother was a nurse in Ashdown, and speaking of great grandmother, like she was very, I guess, doing a job as a nurse but wasn't licensed, and they passed the law that she had to get her license. So at 50 years old, she was already a grandmother, not a great grandmother. She was already a grandmother, went back to get her nursing license. So I've recently looked into all that, and with Sheila's help too, she's dug a lot into it. And so it's just really neat. So she was our first nurse, and she would make house calls, and everybody knew of her as the nurse at the hospital in Ashdown. So my sister decided to go into nursing, and then I decided to as well. And women's health is my passion. So yeah. That's my story.
Nicole, Sheila, are you in a position where you can share?
This is Sheila. Um, as a child, I couldn't decide if I wanted to be a nurse or a hairdresser. How's that for a comparison? But I was leaning towards the nursing thing. But as I grew older, of course, I ended up getting married and having babies. And with my second pregnancy, I had a child who was born with a congenital heart defect. And after spending almost a month at Arkansas Children's Hospital and watching the care that they provided, not just to my son, but also to us, and how caring and dedicated they were, I came away thinking, that's what I want to do. That's what I want to do. But I had 3 preschoolers and a heart baby. But one day my husband said, I think you're supposed to go to nursing school and be a nurse. And I said, I do too. And so I was broke and I had 3 preschoolers and I had no idea how I was going to do it. But we prayed about it. I went to TC and told them this is my dream. They looked at my old transcript and said, oh my goodness. And so we kind of had to work through, first semester of college with a 0.69 grade point and no high school diploma, had a GED. But we worked it out, and here I am, thanks to some great professors who encouraged me, including Dr. Allard, who taught me A&P back then. I have been a nurse now for almost 28 years and honestly can't think of anything else I would rather do.
Awesome. Do you
And you can forget that old GPA thing. She was a great student.
mhm. Yeah. Do you remember, and are you willing to talk about why you told Heather to not do nursing?
Oh, sure. It requires a lot of dedication. It requires a lot of time, and it's a very emotional job. I had worked in ICU before I went to work for the cardiologist, and working in surgical ICU and dealing with a lot of trauma patients, a lot of critically ill patients. Sometimes you lose patients that you shouldn't. And I tend to feel very vested in my patients. And so emotionally, it just wears you out. So I went to work for the cardiologist and absolutely loved it. But once again, man, I needed my patients to all do well, and not everyone does. Having a baby, I thought would be a little bit difficult to split your time between family, a baby, and a career. But I must say that if anyone could do it, it was Heather, and she does a great job with that.
Awesome. Thank you. And I'm not surprised either. I think you all have built in, it's interesting. We asked sort of why it's your jam or how you ended up there. There always seems to be the sort of through narrative, and obviously caring and having a particular jam that you're interested in. I think you've also managed to contextualize for me all the nurses that I hear around COVID saying, the mental stress that's different with all of this, and sort of the way in which they're the last people that some folks are seeing, and all that, why those messages that they're trying to get out are so profound. So I appreciate that. Nicole, I don't want to shut you out if you have the ability to speak. If you don't, that's fine too. Or if you're like, I don't want to.
internet is saying I have low bandwidth. So if you have any issues, let me know.
No, you sound great.
Okay, great. So I wouldn't say that I think that was me. I really wanted to be a teacher in high school, but the closest school I go to be an ag teacher and my dad goes. So anyway, my mom's a nurse and I work with her, and I saw her work codes and I've seen.
Dang it. And now we lost you. The last word I caught was got to see your work clothes. And it fits the same kind of narrative of Jenny. But I'll let you off the hook. The next phase that we run into then is it's open to anybody to answer, and is again me trying to ask good enough questions to avoid Tyler from jumping in. And so far this semester I've been good. So the first question: what specific aspect of being a child do you miss the most? What specific aspect of being a child do you miss the most? And anybody can answer. The assembled nursing staff and faculty and students and others.
For me, in all honesty, like, remember when you cried because you had to take a nap? I miss naps and somebody always having the meal, the 3 meals. It's like breakfast, lunch, dinner. You just walk out of your room from your nap. Here's your food. So for me, that's it. Because I mean, I had lots of great things in childhood, but in this particular moment and season of life, a nap every day at, I think it was 1 to 3 is when we had to nap or whatever, would be amazing. Just absolutely amazing.
I miss not having bills. That was really nice. And at that point, I didn't realize that I had not a care in the world. But looking back on it, I realized how good life was. I mean, it still is good, but you know, bills now.
I agree with both of you for is taking a nap and not having to worry about any bills. I mean, during that time, it was just me going outside and playing, not having to worry about paying any type of bills. And if I'm tired, I could just lay down and take a nap without worried about anything else. Those days are gone.
I miss the days of real lack of responsibility. Right? Although Heather's note of food is just there for you, that the naps are good and all, no bills and all that kind of stuff. But I'm thinking on a daily basis, just to have somebody else deciding what we're going to eat and have it cooked and have gotten the groceries and done all the things. That's pretty good. Others have idea what they miss? Okay. So the other thing that I miss is that I could be gone for hours at a time and no one had to know, and I didn't have to, you just be gone. I would like to be out of touch. I think you need to get rid of the cell phone and a whole bunch of other things to be able to do it again. Is there anything in Texarkana that you would like to experience as a child rather than as an adult?
I experienced all of Texarkana as a child. So this is home. And well, I always came back here. My husband played professional baseball, so we traveled a lot. Lived in all over the place: Vegas, Pittsburgh, Pennsylvania, lots of fun places in Florida. But like I say, this is home. So what is now Bringle was Waterworks, and we won't talk about my experiences at Waterworks as a child. You know, Wright Patman, all of it, it's, you know, fun. Index Bridge when it was not a good bridge to drive over. So I have good memories of Texarkana from that perspective to begin with. Watching the town that dreaded sundown at Spring Lake Park, because somebody posted Spring Lake Park. You know, you sit out there when you're a small child, and my grandmother lived here during that time. So she had a very different perspective on the movie because she lived it. So that's, for me, it's everything here I already know. So I don't know that I would want to experience anything differently.
Fair.
And we actually used to could walk into the, the little tiny tower things at the front of Spring Lake Park. Well, what should be the front. Actually walk up those when I was a kid, which my kids have never gotten to do. So, and we used to go actually to the well and get water out of the well that is now.
Okay, my kids and I talk about the towers all the time and wishing that they could walk up them. Why were they, do you know why they were originally built, or what was?
I don't know that one. Well, my mother told me they were built to put some kind of lantern somewhere at night. I don't know the validity of her story. I do know why they were closed off. Unfortunately, it had to do with sexual assaults in places when we were probably junior high-ish, I think. So early 90s for the ones who were just born then.
Right. Right. I think I'd like to experience the Christmas, lots of things like the Christmas parade downtown as a child, in part because I'm always comparing things to my youth or other places I've been. And I think having the experience of really childlike wonder of Spring Lake Park or the parade or various different things, I try to see things through my kids' eyes because they experience it differently than I do, right? And what some of the, a different experience that I had. Does anybody else in the room have a thing in Texarkana they'd like to experience as a child? With all the childlike wonder. Fair enough. All right. Of all the movie characters that you've seen, which one do you believe is most like you?
Oh. That's a tough one. Pressed me for that one. Yeah. As long as nobody in the room says Nurse Ratchet, we're good. A horrible one. Probably, and this is going to date me as well. I enjoy the Aurora Tea Garden mysteries because I grew up with Candace Cameron as DJ on Full House, and really watching her in that where she looks for the details and gets in things that really aren't her expertise. That's pretty much me. It's like, oh, murder mystery. Let me go look at that. Oh, let me go over here. Oh, wait, I'm a nurse. I need to go look at the healthcare aspect. So most of my pastimes have nothing to do with nursing, has everything to do with non-nursing things. So I think that'd probably be the easiest one. But again, some of my students may call me Nurse Ratchet right now because it's midterms.
Well, Chandler says, Mr. Magoo, I would say while other people are trying to think, mine's probably, mine will also date me. 16 Candles, the character Anthony Michael Hall played Ted is probably me. But I think I can think of like who I am back in high school more than I can think of who I am now. I don't know who I would be now. Tyler, you thought, I saw you look up in the sky.
Well, it's actually funny that you asked because I just found a BuzzFeed quiz online and I was gonna fill it out to give you a good answer. I don't know. So if you don't already know, I'm an office guy. I like to think I'm a Jim, Jim from The Office, but I'm probably more so of like a good hybrid between him, Ryan Howard, and probably a dash of Michael Scott, so I think I'm a good hybrid of a few Office folks just because I'm obsessed.
Unfortunately, I could think of something besides the Viking movies I'm currently watching because I don't think I want to relate to any of the Viking women. Kind of scary there. It's my current genre of choice, period pieces.
Okay. Everyone else is still pondering, but we'll keep moving. We just showed Smokey and the Bandit the other night. So the same question, what would be a character from a movie that would be quintessential Texarkana? That you could see the character could have been from Texarkana?
Oh,
Because I always think when I think of Texas, and it doesn't even fit necessarily, but I always think of Wilson's character and the sheriff in that movie is somehow being from Texarkana, although I don't think he is. Even
if you hadn't picked that one, actually, that probably would have been one of my choices. But let's just go straight to poor little Boss Hog and his from the Dukes of Hazzard. That character I can see being from here. Mannerisms, and all transparency, some stuck in the old ways. So I can see him being here, since again you took Smokey and the Bandit, because it's actually one of my favorite movies ever. So
I think the Jerry Reed character in Smokey and the Bandit.
Yep. Yeah, I think that fits. I like that. Okay. If you had to wear a button with a maximum of 5 words around, what would the button say?
it's got a no sign through it, and it says, because we've always done it that way. Oh, sorry, that's 7 words.
Yeah, I was just starting to count.
Yeah, it's 7. So we could
It's
just,
because we always have.
yeah, with a line through it.
Right now, it would be wear your mask, no noses showing implied. Yeah.
Right.
This is not appropriate.
Oh,
I like this one, this version.
I've had a lot of trouble watching sporting events lately because I'm watching all the coaches have and the players, and after a while I realized I'm watching mask wearing, not the actual game that people played. Right. So it keeps interrupting. Students, what do you have as for your 5 words? Brooklyn, you're trying to work. Stop working, start answering questions.
Look, I mean, that's priceless right there.
Any context? No, Chandler, you just have to wear it around that people would see. So it could be whatever you wanted. It could be wear your dang mask. It could be anything. Because I was thinking, Chandler, myself, that I would there you go, survive until you thrive. See, I was thinking about things like I just put words on the taco, scotch, cigarette, right, and just a whole bunch of a series of just random words to get people to think about them, so that people would run in and be like, "Oh man, tacos, yes."
That's better than 5 words. Just pick one word. Yeah. Mine, unfortunately, today would just say COVID. Let's talk about COVID or vaccine.
Yeah. So what would Texarkana's button say?
Stuck. And you can run that whichever direction, because you're probably going to run into a stuck. Like that, I've been here my whole life, and I think we're the most stuck now than we've ever been. No growth, no real growth, no change, which changes pretty soon. So.
Yeah. Oh, that's interesting. You only live. I like that, Caleb. I like that also for Texarkana. You only live once against the stuck button.
Yeah. Put them together, so then we're living out of the box.
Right. All right. Everyone hears discussions that they think are boring. What topic puts you to sleep the most? Somebody starts talking about this and
Probably conversations about the 2020 election. I'm like, okay, I'm on to XYZ. It doesn't matter how heated the conversation gets amongst people. I'm out. I'm over it. I'm asleep. Most anything else can intrigue me. All of the conspiracy theories with COVID and the vaccine, and that I'm going to be able to track Doug now after he does his stuff. I can run with all of those things, but the 2020 election, it's a sleeper for me.
So I have a question for you, because I'm sure that you have a lot of people come up to you and ask you, about the vaccine and this or that. So what's your favorite reason as to why someone is not getting the vaccine? Like, what's the most entertaining reason that someone is?
Well, there's two of them actually. The first one is the chip. You're getting microchips so the government can follow you. I'm like, why wouldn't we just do that with your first? Yeah, that's gonna follow you. We could do that with your first injection when you're born if we wanted to chip you. And the second one honestly has to be that it completely alters your DNA structure. I'm like, okay, that is one really good vaccine to alter your entire DNA structure. But those are my two favorite right now. Also
I was
shows
actually hoping both were true. I wanted to be chipped so that if I ever got lost, they could find me, because I have a tendency to get lost. And 10 years ago, something in my genetics tripped. Right. Well, your phone could die. Right. The battery isn't charged, all that kind of stuff. But if I were chipped, be like, go anywhere I want in the world and they could find me. I think that's great. Because where I go is not that fascinating. People are not going to be constantly tuning in to see where Doug is going in the world. But the other is the idea of changing your DNA. I was like, I had a genetic switch 10 years ago and got my kidney crap. Let's go ahead and do that. Let's go ahead and inject me with something. Let's roll the dice.
Yeah, see if it'll fix it.
Maybe.
I'll jump on that. We all have something in our DNA that's not quite right. Let's fix it.
Yeah, I think, and especially it's been fun in COVID too. The phone does track where I go and all kinds of different stuff. But I get an email once a month reporting to the number of places I've been, and it's usually 1 or 2.
Mm-hmm.
And you've been to 2 places this month. So.
Mine counts my shop as a different location than my house, which is literally, 12 steps from my house. I'm like, oh, look, I've been multiple places today. Like Sheila said, it's a method of population control. So I guess we're killing people off with the vaccine now. And then conspiracies, yeah.
I would actually be for that population control, but it's too darn many people in the world.
Yes.
Yeah. Is that your biological position, or is that your personal position?
That is my environmental position, that there are too many people and we're ravaging the place.
We could definitely be better stewards. I know that's true. Okay. What is something in Texarkana that local folk find exciting that puts you to sleep?
Oh.
No interest in it. Yeah, it's I'll repeat the question. Is there something in Texarkana that the local folk here seem incredibly excited about and enjoy, but would absolutely bore you to tears?
I am the local folk, I guess. But in all honesty, the whole taking your picture at the post office just makes me giggle. And it has since, always has made me giggle. I'm like, okay, so you're standing in 2 states. Okay. But again, I'm not sure what I find absolutely intriguing to tell people to run there, except for the lakes. I'll tell you to go to the lake any day, or the trails. which may put people to sleep. I don't know. Or non-local people aren't going to say anything. It will not offend me. Trust me. I've heard it all. Sheila said selfies in the restaurants in town.
Well, I think I've lived here all your life, Heather, and probably not quite, but the craze with Bryce's cafeteria, which no longer exists, but
Mhm.
you know, I didn't really think it was that good, but it was okay.
It was a strange.
Expected- David, when I got down here, we went a couple times and I expected it to be more than it was. I'm not really, you know, I think you watch, I probably watch far too many cooking shows where they go to, you know, really good, you know, one of those kind of restaurants where you get a blue plate special type of thing. And that was not what my experience was at Bryce's. Well, no, but see, I didn't have the peach pie. So
That was good. That was good.
that was my mistake. I should have met you sooner, Sheila, before Bryce's had unfortunately closed. The peach pie may have been the thing.
Yeah,
But the vegetables were always overcooked.
and no seasoning. It always reminded me of the elementary and middle school cafeteria. I didn't like eating on the tray then. Why did I want to go pay to eat on which? Yeah, to pay to eat on.
I think that's an apt description. The emphasis was definitely on cafeteria at Bryce's. I don't understand the fascination with the Amigo Juans and Zapatas and all the other sort of supposed Tex-Mex things that people are very excited about in town and pack into. And we've eaten it and I just like, I don't get the appeal. Nor do I get the idea why there's butter on the table all the time.
Yeah, the margaritas. Yeah, have the margarita and then come back and report back to us.
And then it's
I'm
all.
going for the wrong reason. I'm going for food when I should be going for booze.
I don't think I've ever had food from Zapata's before. That's probably why I see it in a positive light.
It probably is.
Okay. But Ivan wants to ask the question for people that have lived here for a while. What can I ask? What one place that you guys love visiting? Where is the thing that you have to experience in Texarkana?
The Perot would probably be my choice. I believe it's opening back up. And truly experience from a touring standpoint, not just watching a ballet or a symphony, but the history and the architecture of that building is quite phenomenal. And for me, gone there my whole life, dance recitals, plays, the Nutcracker, whole 9 yards. Most of the years I sat on the floor. And my parents had always told me, oh no, you need to go experience the upper level. And I'm like, what's the difference? And then they would joke, and it was a Coke cap to go, and you had to sit on the upper level if you brought your Coke cap. And I was like, okay. I got tickets to the upper level, and I will never sit up there again. The seats are smaller and packed closer together. And I was thankful that I didn't get my husband a seat beside me because he wouldn't have fit because he's 6'5". So then you dig into, and you may know this, Doug, when you start digging further into the development and when they built the Perot, the upper level was built for the colored population. And so they were crammed in and they had the least visible seats. And so I went back and asked my parents that once I learned that piece of history. And Mom and Dad grew up here when integration happened. And they said, oh yeah, we all went up there and threw things at the people downstairs who could afford the better seats once integration happened. But they said, we just thought you knew that it was smaller and cramped and not a comfortable place. So it's another place here that if you're really into detail and architectural history and seeing how in reality the differences that we don't really think about that much more or that much now, it's a place to go. they did some virtual tours during COVID too, that I think are still posted on their Facebook page.
Yeah, I would say you need to experience a parade downtown. That the downtown will feel entirely different to you during that moment and then after, with a sense of what's possible down there and people maneuvering down. It changes the scene of how you think about it. In the same way Heather, I think, is right about the Perot, but the other thing too is the number of people trafficking into the Perot, and sort of that feeling of vibrancy. Because when you go downtown and there's not an event down there or something going on, it feels sort of like a empty space. When you fill that space with people, it suddenly becomes, I think, incredibly different.
Yeah, what's interesting for me, and I don't feel like I'm that old per se, there is a 4 in front of my age, which doesn't seem old at all. But even in my lifetime here, my mom had a hair salon downtown when I was a kid. So when I was younger, it was a really great place. My father-in-law worked at Belton Jones. My brother-in-laws worked there. And we all went downtown to ride, we called them the alligator, but it was the escalator. So even in my lifetime, downtown was really a place to go. And then it's turned into not so much a place to go. And now it's revitalizing. So yeah, like you say, Doug, once you get people down there, it's so much fun. And there's more going on down there. My youngest child, she's 16. They go down there and take pictures by the artwork, and it's a gathering place for the high school students now. I guess like we gathered on State Line, they gather downtown now. So it's coming along.
I have not been to Railfest. I'll have to check it out, Nicole. That's one of the things that I have not been to.
We used to have graduation at the Perot
Yep.
back in the day.
I went through a period where we did it again, and I liked it. So unfortunately, we're running out of time, but I had time to the last segment of what we do every Faculty Friday is to let Heather have an opportunity to talk about her research interests and the things that she's doing in a non-conference paper sort of way, what she looks at, what's her jam, those kind of things. So Heather, the floor is yours for the end, for as long as you want to talk.
Oh, well, I promise I won't keep y'all over. Really, I take a non-traditional approach to my research agenda. I say that because most nursing faculty and nurses in general are focused on quantitative research, surveys, studies, implementation, looking at clinical practice guidelines. I'm okay with that, but it's not my passion. I lean more towards philosophical inquiry and qualitative research. Really spent some time with Craig Nakashian today talking about moving towards some historical research. So I totally deviate from the norm for a nurse. And I love that about myself, by the way. So currently I'm published in the Journal of Christian Nursing, again, from a philosophical inquiry perspective on spiritual decision-making. So how do you bring your spirituality into your choices and moving forward? Also focus a lot on balance. We used to call it work-life balance, but that's really not a good use of terms because you can never balance the two. So how do you just balance life? How do you balance the season that you're in with, for me, I've got a college junior, I think she is now, and a high school sophomore, and running 3 nursing programs here at the university. So my life balance looks very different today than it did even 5 years ago when I was just faculty. I just got to come and teach and go home. So I focus a lot on those healthy well-being aspects in my my research. Presentation wise, I again stick with that level, focusing on a non-traditional method. I will tell you, focusing on non-traditional nursing research is challenging because you get to explain yourself a lot. Why did you pick this route versus numbers? I do love numbers, don't get me wrong. But if I'm doing, I love them for my job, my admin job. But when I think of my research agenda and things that I want to do, I want it to be engaging and fun. And again, that's me, religion, spirituality, and well-being. Admitting, is that what you asked me to talk about too?
No, you get to talk about what you do, but I'm going to ask you though, what historical research were you thinking about it? Because I think one of the things that I find interesting is that idea of just that, look, I don't want to do the same thing everybody else is doing in some way, shape, or form. I think that you've always struck me as a neat character. But also thinking about it more from, again, it's my jam. But what sort of historical research were you thinking about? I'm curious.
The progression of the different religions. So there was the Protestant persecution, then the rise of Roman Catholic versus Christianity, just all pieces of that change over the years.
Yeah.
I really am honing in on European history at the moment because it's very intriguing to me. But
is there a sense of the sweeping changes in Europe in terms of religion changed the nursing practice, or are you just simply looking as sort of your own way of thinking about it?
no, I think it really did impact nursing. So, Florence Nightingale was at the Crimean War, and she brought into the spiritual aspects of care. Also, she thought, let's just open the windows and give them some fresh air. They might get better. Looking at religion and spirituality and how it connects with nursing, it's changed everything. And even in my master's program, I actually did study on theory and history of nursing. It's totally gone from our education programs now. I think Nicole is actually taking a theoretical course in her PhD, but for the most part, we totally skip over anything that has to do with our history or our theoretical backing or how we bring religion and spirituality into our care setting when you can't separate the two. So it's fascinating to me. It's where I actually love the most about nursing. So looking back and seeing how it all changed and how the shifts have happened. And I'm not sure what happened. I think it has to do with accreditation standards and curriculum guidelines that bumped it out. But
yeah, I think there's oftentimes people playing in realms that they're not, they shouldn't be in. Yeah, it's interesting. I think, I guess the other thing that is a curiosity in my mind, I start to think about history. I keep thinking about the idea of, what were the role of nurses during like plagues? During, right, what's the role of nursing in I get the wrong date. Numbers and I are not friends. The 1917, 1919 pandemic. What is the role of nursing in that?
Spanish influenza.
Yeah.
Yeah. That I haven't until the pandemic now, I haven't really thought that far into it, but really what were they doing? Because I know what our nurses are doing now, but even think of, like say Florence Nightingale was a Crimean War, but our Civil War nurses, who were they? We don't name them all. We name Clara Barton, but there's more. And actually Nicole found this out doing some of her research, is there's theorists out there that we're not naming. If you start digging through the literature, they deserve a name. So really it goes back to, I want to name the people that where we are, not just the one that had the most prominence.
Yeah, and I think it's an interesting connective thread to where you all started off with. If I think about my relationship with the medical community, the people that care the most, right, and the only reason why I could call it medical care that I've received has been my nursing staff. It's not been doctors. They're in charge of the medical practice side. The medical care side is definitely on the side of nurses, and it's an interesting, I think, connective thread. We are close to the end. Does anyone have further questions they'd like to ask Heather before we end our session and invite you all, if you have time, to come join the one at 1 o'clock on another Bat Time and Bat Channel Zoom? Yeah, I did too.
It's been fun.
It's hard to say. I think after every time we do a faculty Friday, I'm like, this is my favorite. After Who's Up Wednesday, I'm like, this is my favorite. After the showcase and hop in, that's my favorite. It's just one of those things. I really, really thank you all for hopping on, the students that are here, as well as faculty and the nursing folk who joined us. It's always a thrill to sort of reconnect with people. I haven't seen Heather in the flesh or had time to bounce with an email here or there. So it's very good to see you, and Sheila and Nicole and who am I forgetting? Somebody, always. At any rate,
Jenny was on here, but she, like,
yeah, that's why I'm looking around my screen trying to find. So thank you, and enjoy. And yeah, we do know that I watched the 1964 version of the Chandler sent me a message. Yeah, that's I came home from school religiously, Chandler, and found myself in the basement of one of my neighbors so that I could watch the Batman that my parents probably thought I didn't need to be watching and probably my homework. So instead I went to Trisha Runyon's basement and I watched Batman every day. Everyone be safe, wear your mask properly. It goes over your mouth and your nose.
Correct.
As Brooklyn is demonstrating.
Thank you.